Despite increasing cases of local transmission of COVID-19 in Bacolod City, Secretary Carlito Galvez, chief implementer against COVID-19, dismisses calls to place the whole city under enhanced community quarantine. The details live from GMA RTV1 Western Visayas, Adrian Prietos. Adrian?
Yes, my local officials in Bacolod City, Negros Occidental, submitted a situation report to the National IATF detailing the number of local cases in communities and among repatriated overseas Filipino workers and locally stranded individuals, or LSIs. The data will be used, as basis by the National IATF to determine the quarantine status of the city. In a recent meeting with Western Visayas officials, National Action Plan Chief Implementer Secretary Carlito Galvez said that localities can no longer afford total lockdowns as we strive to jumpstart our economy. Galvez was responding to an appeal from two medical societies in Bacolod lobbying for the president to place the city under ECQ. The doctors cited limited facilities to respond to the spike in the number of local cases. The Bacolod IATF does not agree with the proposal of the medical societies.
Most of their concerns and recommendations, honestly, na-implement na eh.
Okay.
So I think wala man na diferensya. But for me, ang personal hindi kay Mayor, ang tone wala sang letter. It seems that we are remiss of our responsibilities.
In a position paper, 5 business groups in Bacolod City and Negros Occidental also expressed their opposition to the proposed return of Bacolod City to ECQ status.
Just for the record, we want the public to know that ining mga punto nila nga nabutang sa sulat nila kay Presidente, amo nga ni ang amon nga ging discuss point by point during that teleconference ang nagligad nga Sabado.
Secretary Galvez explained that instead of closing down the whole community, targeted and surgical lockdowns should be implemented.
Yung strategy po natin sa National Action Plan Phase 2 is on how to rebalance our health and economy risk. So nakikita po natin ngayon, ginagawa po natin na we can only open our economy if we will reduce deaths and also manage new cases. Kung ating pabatayan ang NCR, Region 3 at saka Region 4 and the other regions, nakikita natin yung Region 6, okay na okay pa siya. Ibig sabihin, nung tinignan namin, yung kanyang death rate napakababa.
The new strategy enforces localized lockdown of houses, sub-villages, or a cluster of hotspots.
Hindi po practical kasi kung tutusin, nakita po natin ang Manila at saka Cebu, halos libo-libo ang kaso eh. Sila nag-GCQ. Samantalang Bacolod, maliit pa lang. At saka konti pa ang namamatay.
The implementers plan to increase the testing capacity of the region from 2,000 to 4,000 persons per day, adding that each LGU should establish its own molecular laboratory. On the other hand, Senate Minority Leader Franklin Drilon criticized the performance of the National IATF in fighting the spread of the virus.
Gaway man siyang improvement. So sa akon, the IATF has failed to provide the leadership needed for us to help the people. Ang problema pa natin is that the Department of Health no longer has the credibility.
Meanwhile, President Duterte, in a televised speech yesterday, extended the modified general community quarantine status of the provinces and cities in Western Visayas. In the local situationer submitted to the National IATF, the Bacolod City LGU reported that among the recent cases, 52% are local transmissions. 7 deaths have been reported in Bacolod and more than 10 areas were sealed off due to the rise of COVID-19 cases. As of today in Bacolod City, 74 new cases have been recorded. Back to you, Mai.
Thank you, Adrian Prietos.